Okay, Healthcare Whisper is a patient advocacy and healthcare navigation business. I'm a link between the consumer and the healthcare system from any aspect, from working with insurance companies, from finding a doctor, any kind of issue that comes up in healthcare that people find themselves a little bit confused about. So I think that's evolving. I think today in this conference what we're finding is that the role of the patient is definitely evolving. Is there something they need to do? Unfortunately, in this day and age, they need to be informed and educated, and a lot of people aren't. And I think that's the role that technology is changing, because there's more sites available for people to find out, about disease process, about doctors, about hospitals, and about insurance companies. There aren't often a lot that is as helpful how to do it. So I think there's a gap between patients knowing how to get through the system versus what's available now. So I think that's the big difference. Well, of course there's WebMD, because it's giving basic information. That's where people go to start. But I find that the sites that are really helpful are for consumers after they get that basic information is sites like Livestrong, the very specific disease-oriented sites that give them more personal information. A lot of times when you go to the technology like WebMD and even Mayo Clinic or even the insurance companies, you're not going to get a very personalized look. When you go to these very specific sites like Livestrong and say the Lymphoma Association, the Brain Injury, so if you're looking for specific disease processes, then you're going to get a connection with someone, and people are looking for that connection, because a lot of times their doctors can't help them, their nurses can't help them, so they need more personal information about how to do it. Well, I would like to say that there's going to be easier access. I mean, that's what I'm hoping for, is that there'll be easier access. What I think is going to happen is that people will find themselves not having to worry about pre-existing diseases. That's what I find. There's going to be more access for people. But the ability to get that access is going to be difficult. I don't see it as something that is going to be easy for most folks right now. And I don't know about the accessibility. I don't mean to be a naysayer in all this, but I'm concerned that the consumer is still going to be left with a heavy burden for cost and not have the access that they need and the care that they need. So one thing I want to go back to, actually, one site that I really liked that I forgot to mention was ICU, because that is where I actually send a lot of patients to get that personal information. And so I think it's very important. That site offers more than I've seen on any sites actually for people to access information. So I didn't mention that, but I wanted to go back and mention that for you.
You should mention that she's not getting paid to say that.
Yeah, okay, I want to say that too. You're not being paid, but in reality, I do find that that's a great site.
Thank you.